Hi, I'm Rebecca Arujo, contributing writer for DocWire News. I'm here today to speak with Dr. Scott Tagawa, Professor of Medicine and Urology at Weill Cornell Medicine. We'll be talking a bit today about the future of prostate cancer treatment options. So, Dr. Tagawa, to start, what are some treatments for prostate cancer that are currently in the pipeline that you are interested in?
So one aspect of what I'd call the pipeline is better utilizing existing drugs. So it's not necessarily new drugs, but existing drugs, looking for often earlier disease states, because a lot of our drugs are approved in kind of late stages, pre-treated cancers, and they might work better earlier. So that's one set of existing drugs I would call in the pipeline, and also combinations of these existing drugs with, for instance, 2 approved drugs or 1 approved drug plus an unapproved drug. So that's kind of generically something that I'm excited about, because rather than, I don't want to say just improving survival and quality of life, because I think those are important, but maybe further up we're improving cure rates. I think that is just generically a direction that we're going. So I suspect that one of the next drugs, or the next drug to get approved for prostate cancer, is likely to be an LHRH antagonist. Happens to be an oral version of that called relugolix. There was prior phase 2 data presented and published, and then earlier this year at ASCO, followed by a New England Journal publication, was a phase 3 trial head-to-head against LHRH agonist leuprolide, with mostly superiority, non-inferiority as well as superiority data, as well as some interesting cardiovascular event data that looks to be similar to other drugs in class. So I suspect that drug will be approved as another drug within the same class. So in the United States, it will be the second drug. In Europe, there's an additional one available. But what is unique about this drug is the modality of administration, being by mouth rather than injection. So, a lot of times that is preferred in general, but I would say particularly relevant during this pandemic. That may be useful for a subset of our patients. So that, I suspect, is one of the next drugs to get approved. There's another drug that had a positive phase 3. So in theory could get approved, ipatasertib, which is an AKT inhibitor. So we know that the PI3 kinase pathway is quite important in prostate cancer, particularly as it comes to AR resistance. So there was a randomized phase 2 with that drug that looked very interesting, and then a biomarker-driven phase 3 trial, which was presented at ASCO, that was positive for the primary endpoint of radiographic progression-free survival. Unclear if that would actually lead to approval, because the amount of survival of radiographic progression-free survival was not that great, and at the cost of some toxicity. So I guess I wouldn't be shocked if it's approved, and I always like to have additional drugs that are in the clinic. But I wouldn't be surprised if it's not approved based upon that. So I'd like to see more work go on with that drug, because it looks like at least a different way to identify the patients with next generation sequencing as the biomarker might improve the benefit to risk ratio with that drug. And then maybe other combinations or additional, quote, better drugs that are targeting that pathway in some respect, because we know the pathway is quite important. We've just had problems finding a drug that is tolerable when targeting that pathway.